Breast cancer, it is the second most common cancer among women in the U.S. And this week, doctors and researchers from the entire world joined the 2021 San Antonio Breast Cancer Symposium to discuss the latest treatments and findings.
And joining us now for today's KSAT Q&A to talk about this disease, Dr. Virginia Kaklamani. She is an oncologist with UT Health San Antonio MD Anderson Cancer Center. Doctor, thanks for being here this week. We have gotten so many questions in light of this symposium from viewers who want to know about this illness. And I want to get to the first one that we've received multiple questions about: dense breast tissue. Some viewers wrote to us saying, I get a mammogram, but they say, well, just keep in mind you have dense breast tissue. What does that mean, and what should someone take from that when they get that diagnosis, essentially?
So women that have dense breasts have an increased risk of getting breast cancer. Having said that, we don't do anything differently. So I would urge your viewers to discard that information. It's important that we go for mammograms. It's important that the radiologists do a good job looking at the mammograms. But the breast density, even though it's on the reports and it has to do with legislature, we don't act on it.
Okay, now when it comes to breast exams, what exactly should we be looking for when we conduct these ourselves, and how often should we do them?
Well, actually, we should not be doing them. This is a change in the past few years from our recommendations, that the recommendations are against women doing self-breast exams, because unfortunately, most women are not taught how to do a breast exam, and therefore they see something, they get very upset, they see a physician only to find out that it's nothing. Having said that, there was a nurses study that looked at teaching nurses how to do an exam. And when the nurses were taught how to do an exam, they actually were able to detect breast cancer. So the bottom line is, be aware of your breasts. Look at your breasts, make sure that you don't see any changes. And if you do not ignore that. Talk to your physician.
That is a big change that I'm actually surprised to hear. I hadn't heard that self-exams are no longer recommended. Steph and I were talking about, would we know what to look for? Would we know what we're looking for and feeling for? So if somebody does notice a change, though, they're not sure what it is, what should be their first step?
Go to your doctor right away. Make sure that you have imaging. And if the imaging doesn't show anything, and that's important, it doesn't mean that it's nothing. It means that you may still need a biopsy. If the imaging does show something and it looks like it's benign, so not cancerous, that's okay. But if the imaging doesn't show anything, and sometimes in those dense breasts, it might not, we still need to pursue it further to make sure it's not cancer.
And when we talk about changes in the breast that should be concerning, could you give us specific examples of what those changes would be that should alarm us?
So if a woman looks at herself in the mirror before she takes a shower or after, and she looks at her breasts, she can see different changes in how the breasts look. If you see a lump, it's actually pretty easy to realize that this should not be there. Another thing to look out for is changes in the nipple. If there are, such as inversion of the nipple, that's something that's extremely important. We cannot ignore. Sometimes there's nipple secretions, and that, again, is not something to ignore.
Another viewer question that we got multiple on: triple negative breast cancer. Can you explain what that is?
So when we look at breast cancer, we look at three markers: the estrogen receptor, the progesterone receptor, and another marker called HER2. In cancers that don't express any of those receptors, we've used the name triple negative. It's kind of hard because it means that they don't express anything. They can be aggressive. We typically treat them with chemotherapy. At our symposium the past few days, we've had so many updates on triple negative breast cancer, so we're coming up with new treatments. But for now, it's the most aggressive type of breast cancer.
Now, also, a big thing is family history, but, there are many women who say, I don't know of anybody in my family who has breast cancer, yet I've been diagnosed. We'd had one of those viewers actually reach out to us. Just for those of us who maybe are a little younger or don't have a history of breast cancer in our family, but obviously are still concerned about this, what should we do?
Well, 1 in 8 breast cancers, 1 in 8 women get breast cancer. So just because you don't have a family history doesn't mean that you're not at risk. We're at risk just by being women. So please make sure that you, again, are aware of your breast health, that you go for mammograms starting at the age of 40, and that if there's any changes, you let your physician know right away. It's not just a family history.
One viewer who wrote into us said that she does have a family history of it. She says, I have 3 family members that have had breast cancer, including my identical twin sister. What should I do to watch for that?
So one of the things that's important for this viewer is whether she's a candidate for genetic testing. There's many women that will get breast cancer because of their family history and because of the genes that they carry. And it's very easy for us to detect that and help detect early breast cancer or prevent it altogether. So the other thing is that she might be a candidate for more intense screening, such as screening with MRIs. So that's something that she, again, needs to talk to her physician, make sure she gets referred to a genetic counselor and potentially a specialist.
When you talk about genetic testing, are you referring to the BRCA gene?
Exactly. But now we have probably another 20 some genes that we test for. But the most common ones are BRCA1 and BRCA2.
When someone hears that diagnosis of cancer, often the first thing people think of in terms of treatment, chemotherapy. Can you talk about any other treatments or advances in treatments that are on the table now?
We're trying really hard to decrease the number of patients that need chemotherapy. And that, again, is something that we've talked about in the past 4 days here. So optimization of treatment, treat patients as aggressively as they need to be treated. The other treatments that we have available is endocrine therapy, so anti-estrogen treatment. We give immunotherapy, and immunotherapy is drugs that empower our immune system to kill the breast cancer. And so those are very powerful tools. And then other targeted drugs that look at a specific target in the breast cancer that do not include any chemotherapy, but sometimes we also combine them with chemotherapy.
Understood. All right, Dr. Virginia Kaklamani, an oncologist here with San Antonio. Thank you so much for joining us today. We really appreciate it. And if you have any other questions about breast cancer for our viewers out there, we have, if you go to our website, ksat.com, you'll find a list of questions and answers from local experts here in our area. Thank you so much.
Yeah, Doctor, thank
you.
We'll be right back.